Our next presenter comes to us. We talk a lot about primary care and the movement of patients towards primary care. And I think Jaweeda gives us something here to listen to, which shows us really how primary care practice might absolutely revolutionise. Jaweeda.
Good afternoon, everyone. My name's Jaweeda. I'm a local Manchester girl, actually. I was born just about a mile down the road in Old Trafford, and I went to a local primary school here, and I'm not ashamed to say I actually failed my 11 plus. So my high school was just across the bridge from here, so it's really nice to be back home and be somewhere where I'm very proud to be part of. So thank you for giving me the opportunity. I'm a GP in Stockport. I work at a practice called the Alvanley Family Practice in Woodley. I work there with my husband, Mark Gallagher, and we've been practicing in that practice for nearly 20 years. So we're not spring chickens when it comes to primary care and general practice. And what we've known for a long, long time is that health does go beyond medicine. We know the determinants of health are not just based on medicine, but they're determined by many other factors. We heard Andy Burnham earlier talking about the World Health Organization's definition, talking about how social skills impact on our health, how economics, housing, and many other aspects can impact on our health. So for us as GPs in that practice, we knew what our values were. Our values were actually to change the paradigm from illness to wellness. So what do we know about social prescribing? Social prescribing has a lot of definitions. There's a lot of technical definitions. But for me, what social prescribing is understanding that the determinants of health are not just medicine and finding ways that we can support our patients. So I know as a GP that's been practicing a long time that at least 1 in 5 of my patients will have a social need. And that social need is something I can't meet. But I also know that that impacts on them. It impacts on how they access general practice and demand in general practice. It impacts on how they access emergency medicine departments and how they utilise our services. So there was a recent publication in June this year from the University of Westminster which talked about the impact of social prescribing. And there's some telling evaluation from that. What Polly et al.'s colleagues tell us is that we can reduce the demand in general practice by 28% with properly embedded social prescribing. We can reduce the demand in ED attendances by 28% if we can embed social prescribing. Now, there's many models out there that describe social prescribing, but for us, we wanted primary care, we wanted the GP practice to be at the heart of this. So I'm going to talk to you a little bit about our journey. We started off prior to March with something called the Practice Wednesday Wanderers, and that was just a little walking group we set up for our patients and practice champions. It was open to anyone, and quite a few number of our patients started to attend, and sometimes our healthcare assistant attended or one of our receptionists. And what we found very quickly is that the group that started to attend started to interact. Now, we talk about Gantt's social movements, but my colleague Donna Sager talks about social moments. And these people, once they got together, started to share their experiences, their lives. And one of them, a gentleman called David, started to talk to one of the other chaps who came on the walk. This chap had lost his wife to T-cell lymphoma, and he was recently bereaved and really struggling, and really found it difficult to talk about his experience of his bereavement. So what David said to him was, do you know you could go to Beechwood? They offer some fantastic bereavement counselling. You don't need to see the GP. You could ring them up yourself and go. And that's what Harry did. And for me, I started to recognise the power of that conversation, of those social connections, and how being part of a community asset is much more than just a GP practice. It's how those individuals interact with each other within the community. So that saved a GP appointment, but much more than that, that was a connection for those two people. We knew that this was making a difference to our patients, so when the opportunity arose, our public health lead, Donna Sager, had given the opportunity to 3 practices in Stockport to perhaps pilot with an organisation called Altogether Better to see how they could embed social prescribing at a practice level and develop the model of practice champions. We were inundated and ended up with 17 committed individuals who wanted to give something back. But what was different about our model from traditional volunteers, we weren't asking people to come in and stack up the magazines in the waiting room. We were asking people what mattered to them. We were asking them, what skills and strengths do you have, and how do you want to work together to make a difference to your community? And we were overwhelmed by this team. They became very quickly great friends. They bonded. And the sort of skill base they had was phenomenal. One could sing, one could play the guitar, another could play the keyboard. And they thought, well, I could start a singing group. Another one said, well, I'm going to go on those walks. And others were saying, well, I'm a young mum and I've got a baby and I felt really isolated when I had that baby. I think I'll start a pram pushers group and do some walks with them. So they came up with their own ideas. And my role as a GP was just to facilitate and support that. But what mattered to them was that they actually felt safe doing that because it was from within general practice. I have an inspirational practice manager, Kay, who some of you may have heard earlier this morning talking about the practice champions. What we committed was that she would give at least half a day a week of her time to support this model because we knew it was going to make a difference to our patients. There's a photograph of them there having a meeting. So, Alvanley Family Practice, the clue's in the title, family. We're a small practice. My husband is one of the partners in the practice, and the practice champions saw themselves as an extension of our family, and they really wanted to be embedded in that. And we wanted to embrace true co-production, so we were not going to dictate what mattered to them. We were going to let them tell us what they felt they could do for their community. And they took a literal translation of the term prescribing and created their own wellbeing prescription, which you can see here. I've got some copies if anybody would like to see it. It's full of typos, but it's great because it's theirs and they've co-produced it. And the sort of initiatives that they've started are fabulous. So we do work with the Kindling Trust. We do vegetables on prescription, and some of the champions love to grow their own vegetables. They've started to do a cookery group. They've started to do their walks, and the singing group is a particular favourite of mine. I'm not really singing in that picture. My favourite song is Delilah by Tom Jones, for those of you who are old enough to remember it, and they do sing that when I'm there, thankfully for me. But if you look, there's a cafe there that we've actually started to work with. The cafe is a small business just in our community, and on a Wednesday afternoon that cafe was empty. So as a local business they had nobody going there, and now there's standing room only. So we're supporting that local business, and we're actually supporting the community. And you can see a picture of John and Harry there, because they now go into local care homes and are actually singing. They form their own constitution as well, and they're absolutely committed to rolling this model out. But it's not exclusive to my patients. They welcome anyone and everyone. Here's a picture of David Cholton. He's our chair and the practice champion lead. He's done a lot of the work. He comes from a good background. He's worked in the housing sector before. And again, he uses his great IT skills with another gentleman called Alan. And what they do is actually help enhance the IT skills of our patients. So they'll often sit in the waiting room. They'll help older people try and use the self-check-in. They'll actually support people on accessing their GP medical record or how to use their online prescriptions. All of this goes towards reducing demand in general practice. So something as GPs I would be very grateful for. But it's much more than that. It's about empowering those individuals to take more control of their lives. So I just want to talk about one story. I'm conscious of time. Flo is a lady, that's not really Flo, it's a picture of a lady. But Flo is a lady who was bereaved last year. Her husband died, she has no children nearby, and she was coming to the practice frequently, speaking to receptionists, speaking to the GPs, often booking an appointment almost weekly to see us. She was in our top 3 attender as far as GP demands go, and she utilises a lot of secondary care services too. She was too shy and reluctant to become a practice champion, but they did encourage her to join the singing group. And what was fantastic from March is that she made a number of new friends in that singing group who she now meets every other day. And funnily enough, I don't see her every week in the practice anymore, and my receptionist have really noticed that she's not attending, but we know she's well and we know she's happy. So this model might seem very soft, but actually it's having a huge impact. And I just want to touch on the benefits that I can see. There have been some real benefits for us seeing a reduction in GP demand. Our staff have virtually no sick leave. They've embraced this model, they've embraced our values. They like being part of those practice champions and part of that extension of the Alvanley family practice. They take up far less time from a social perspective because we have these wellbeing prescriptions in every room. And there are some unintended benefits. GP morale is one of them. We are in a situation where GPs are struggling. We can't recruit. Resilience is low, but I can honestly say it's certainly given me a new lease of life, and I know Mark loves the work that we do with our practice champions. It really is. It's almost 40 hours of additional capacity and support. And also, I think the fact that we're making a difference to local businesses is something that you can't forget. I don't know how you measure that, but I think as leaders of the health and social care system, you have an opportunity to influence this. As you know, I was very lucky. Donna Sager, my colleague in public health, saw this opportunity and she really wanted to support it. I hope we can roll this out and scale it up. Thank you.